Good evening. Welcome to Wednesday Night Study Live here on Tisha Talks Mental Wellness. Happy you're able to join us. This is where we meet up to study for addiction counselor exams. Some of you may be studying for alcohol and drug exam. Some of you may be just interested in the topic, but this is where we gather to master foundational topics so you can pass. Welcome. Come on in. I'm glad you're able to join me live. If you can hear me clearly as you come in, please put a one in the chat so I can make sure we're all good. I'm trying to get better at this streaming thing, you guys. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. By day, I'm a therapist, educator, trainer. By night, I'm your study partner. This is our little part of the internet where we study alcohol and drug counselor education. So come on in, put a one in the chat. Hello to the playback. Sorry you couldn't make it live with us, but you're here in spirit and you still have to do your practice questions. So hello to the playback. Make sure you put your name and what test you're studying for or what state you're studying in. Welcome if you are new to this learning community. If you are not new to this learning community, tell me what you've been working on. What's your study strategy? What topics are you having a hard time with? What topics do you think you've mastered? Again, welcome playback. While you're here, make sure you are subscribed to the channel. That helps us get in the algorithm so other study partners can find us. We are 2,800 study partners strong. Thank you guys. Give yourself a hand. So we are on our way to 3,000 study partners. I can't believe it. We've had study partners pass the following exams: the ADC, the AADC, the MAC exam, the NCAC 1, the NCAC 2, and a few certifications in California. So, congratulations to everyone who is still with us, logging in, even though you've passed. Um, Frequently asked questions. We are not studying for a specific exam because we're all studying for different exams. However, we are mastering those foundational topics that are found on all of the exams. My questions are developed in multiple choice format because that's the format I happen to like. It doesn't mean that your test is going to be in that specific format, but you still can benefit from learning these answers and studying. So again, as you come in, please like the video. Make sure you're subscribed. Good evening, everyone. Hello, Letitia Bank. Hello, I am studying for the CADC in Illinois. Well, welcome. You're in the right place. ADC is in first place. We've had the most study partners pass the ADC. So good evening, everyone. Good evening, everyone. Good evening, Joy. Good evening, Juan. Good evening, Yolanda. Hey, Yolanda. That's my hometown. Do we know each other? Are we cousins? I was born and raised in Suffolk, Virginia. I probably do know you or your family. Good evening, Della. Good evening, Shanika. Hey, Shanika. Shanika's near us too, y'all. All right. Good evening, Joan. I'm glad everybody can join us. Can you guys put a one in the chat to let me know if you can hear me clearly so I can go ahead and get started? I hope everyone is well this evening. For some reason, I'm losing my voice. I don't know why. Well, I kind of know why. I usually don't do more than 3 sessions in a day, and the other day I did 6. I was showing off, and my voice is like, girl, I literally was talking all day long. And it was kind of fun. I used to could do like 6 or 7, 8 clients in a day. I can't do that anymore. I'll lose my voice. But yeah, I was showing off the other day, so I'm going to try to keep my voice moisturized so we can get through our study session tonight. Hello, Angel Scent. Hello, Joanne. Hello, Tracy. Hi, Lee Mills. Lee Mills is working with gambling and addiction. Awesome. All right. Glad to see all of your ones. Let's go ahead and get started. Welcome, study partners. Today we're going to review 10 practice exam questions together. Again, we are studying for general foundational topics that all of us need to know, whether you're in a college program, whether you're studying for an advanced certification, or if you're doing an introductory certification. We all need to know these topics that we're going over. If you would like additional resources, if you haven't got the free download, the link is in the description on my Stan store. So I have a free study guide. I have a 100 questions practice test. And then I have a more in-depth checklist. The checklist is like 67 pages. And it kind of like guides you through the main topics, and it asks you questions that you have questions that you can ask yourself back to kind of gauge which topics you are mastering. And I also have one-to-one if you're interested in one-to-one. All of that is in my Stan store. Okay, so the reason why we gather here together is because it helps us with our clinical reasoning. So it's one thing to know lots of information. Most of us are already clinicians. We're already working in the field with several years of experience. However, when we're taking in all of this information. So we work every day on top of trying to study. You need to figure out a way to master the topic, but also be able to clinically reason through some of these questions. So some of the advanced certifications, they'll have scenarios. So not only do you need to know the foundational knowledge, you need to know how to apply it. So I'll read the question. I'll give you a moment, and then you'll put your answer in the chat. And then I'll reveal the question with the reasoning behind why the answers are right. And I'll even give you explanation as to why some of the answers are maybe incorrect or not the best answer. So that's like you getting like double study time. All right. Treatment plan review and modification. So if you haven't checked out the playlist, I do have a 12 core functions playlist, and there is a treatment planning video. But tonight we're talking about how to review and modify. So we're getting more into our clinical reasoning, our case conceptualizations. So this is going to be really good for everyone, but especially for those of you who are studying for the MAC exam, the AADC, or the NCAC2, because those exams tend to test you a little bit more deeper on your ability to put a case together and make changes and things like that. So our practice questions will focus on how and when to review, update, and modify a treatment plan. As you answer your questions tonight and as you work through our study time, think about these key concepts. Is the client making progress towards their goals? Has their readiness to change increased or decreased? Has new assessment information changed for understanding your client in the case? Have your client's needs, strengths, culture, or preferences changed? Does the treatment plan need new goals, objectives, updated objectives, or different interventions? And was the client involved in making those changes? So now we're taking our foundational knowledge of treatment plans and we're going to put it in action. So that's what they want to know. They want to know, okay, you know what a treatment plan is? When can you change the treatment plan? How do you change it? What would be the reason? Who makes the changes? What to know. So this is your knowledge piece. What do you need to know about making treatment plan changes? One, you need to know what phase of treatment you're in. Is it the beginning, the middle, or the end? You need to understand engagement. So, how are you building rapport or completing assessments and increasing the client's motivation? So, how are you getting the knowledge? How are you getting what you know about the client? So that's gonna fall under a few categories like counseling skills, assessment skills. Because the better you get at that, the more the information you have is gonna be more solid, so you can be able to have better treatment outcomes. Also, active treatment. What goals is the client working towards, and what new skills does the client need? And then maintenance and recovery. How are you going to support the client with preventing relapse and preparing for relapse? I know sometimes people don't want to hear that, but We're not in fairy tale land. Relapse is a part of the process. Sometimes people even prepare for it. I know some people don't. They're like, why would you prepare to go back to using? But it's a part of the process. So how are you supporting the client with preventing, but what to do if relapse happens, and how they can maintain long-term recovery? Secondly, person-centered factors. You're going to be tested on how you understand that each client is their own individual. So every treatment plan is going to be different. Every theory you're going to apply differently depending on the client's needs. So you need to be able to answer those questions. Things that impact person-centered treatment is culture, beliefs, demographics, physical health, mental health, their environment, where they stay, are they in a rural area, their access, and so on. You also want to ask yourself when you're answering questions, does this treatment plan fit the person or still fit the person? If you ask questions about how you change your treatment plan and how you make updates, always look for person-centered, individualized care. 3, risk factors and stressors. You need to understand how you reassess for new risk. So, as addiction professionals, we do a screening, we do an assessment, we do a diagnosis if needed. Then you support them with developing their goals. But guess what? All of that can change. You can constantly screen the client throughout the service. You can reassess as needed. Treatment plan objectives and goals can be adjusted. So any questions about that, it all is a living document that can be changed at any time in collaboration with the client. All right. Let me check. All right. Okay, what skills do you need to be able to do as an addiction professional, and what skills do you need to show on your addiction counselor exam? You need to be able to show that you can modify a treatment plan and take the appropriate steps. You need to also show collaboration with the client. So, obviously, most of us are clinicians in here. Someone who does not work in the field might say, okay, since I'm the professional and I know what I'm doing, when the client needs something changed, we just change it. But we know, working in the field, no, it's always a collaboration. So if you're asked about treatment plan changes, it's always going to be the reason is the client's need has changed, and you work with the client to adjust and modify, and it must fit their particular needs. 3, how to integrate new information into case conceptualization. So as you're building the case, how are you getting accurate information? How are you using your counseling skills to build rapport and build the therapeutic relationship with the client so you can get accurate information so the client service is individualized? As you learn more about the client, your understanding of the case should evolve. 4, you need to be able to document. So, documentation skills. So, you need to accurately document screening information, assessment information. You need to document diagnosis criteria. So, if you're going to be diagnosing the client, your documentation should always go back to the criteria that we learn per the DSM 5 and level of care stuff with the ASAM. Also, you need to be able to recognize readiness, needs, and preferences. Okay, question 1. A client has attended treatment consistently for 6 weeks. Although they have reduced alcohol use, they report they are not ready to stop drinking completely. What is the most appropriate counselor response? A, inform the client that abstinence is required and maintain the original treatment plan. B, discharge the client because treatment goals have not been met. C, collaboratively revise the treatment plan to reflect the client's current stage of change while continuing to encourage progress. Or D, delay any treatment plan changes until the client commits to abstinence. What is the most appropriate response as the counselor? Okay. I see it C's. Correct. C is correct. Collaborate to revise the treatment plan to reflect the client's current stage of change. The client has demonstrated progress by reducing alcohol, but has expressed they are not ready for complete abstinence. Rather than insisting on the original treatment plan or discharging, the counselor should collaboratively review and modify the treatment plan based on the client's current readiness for change. A is incorrect because this response is not centered around collaboration and is not person centered. The counselor ignores the client's current readiness for change and fails to modify the treatment plan. So that would be incorrect. B is incorrect because the client is actually demonstrating progress by reducing alcohol and consistently attending treatment. A lack of complete abstinence does not automatically justify discharge. And D is incorrect because waiting ignores valuable assessment information. Treatment plans should be updated whenever new information becomes available. All right. So if you get a question like this about changing, or the client expressing a need to not want to stop, or they identify their level, their stage of change that they're in, the exam is asking you whether they want to know if you understand that treatment planning is ongoing and it's a collaborative process. The counselor must continuously assess progress, readiness for change, and client preferences. So they're testing your ability to recognize that treatment plans are not a document that you can't change. It's ongoing, and you may change it several times. All right, so the knowledge you need to know: phases of treatment, readiness for change, treatment planning, how to collaborate with clients, person-centered care, treatment plan modifications, and client needs. Question 2. A counselor is reviewing a treatment plan with a client. Which action best demonstrates person-centered care? A, keeping the treatment goals unchanged because they were approved at intake. B, revising goals without discussing them to improve documentation efficiency. C, collaborating with the client to review progress, barriers, and treatment priorities. Or D, allowing the counselor to determine which goals are most important. Which best demonstrates person-centered care? Okay, C. See some more C's. A sea of C's. You are correct. C is the correct answer. Collaborating with the client to review progress, barriers, and treatment priorities. Person-centered care means that the treatment is developed with the client rather than for the client. The client's voice, preferences, values, and culture strengths and readiness for change should guide treatment planning whenever clinically appropriate. So it's evidence-based that collaboration improves engagement, increases motivation, and supports better treatment outcomes. A is incorrect because treatment plans are documents that should be reviewed and updated throughout treatment. B is incorrect because treatment plans may need revision. Changing goals without involving the client is not person-centered. So if you get a question about changing, updating, it should include with the client. And D is incorrect because counselors contribute our clinical expertise, but treatment planning should not be counselor directed alone. Effective treatment plan, it balances clinical judgment with the client's goals, values, culture, preferences, and whatever stage of change they're in. So a question like this on the exam is asking if you understand person-centered treatment. That means every single client you come in contact with is going to be different. They may have the same diagnosis, same race, same sex, same general trauma, but they're still going to be different. They're going to be differences. So everything should be person centered. And then they're also testing your ability to understand that it's a shared process. So even though you're the expert, you're the certified and licensed professional, nothing moves without the client because they're the expert in their life. You're just the expert on this particular specialty in mental health care or substance use and mental health care. What you need to know, you need to understand person-centered care, how to collaborate with the client, and that will fall under like counseling skills, building rapport, ongoing assessment, understand readiness for change, and how to review a treatment plan and how to modify. Question 3. A client who initially presented with alcohol misuse now reports worsening symptoms of depression and difficulty completing daily activities. What should the counselor do first? A. Continue focusing only on substance use goals. B. Integrate the new clinical information into the case conceptualization and review whether the treatment plan requires modification. C. Refer the client for discharge. D. Remove the substance use goals until depression improves. What should you do first? The client presented with one need, and now the need has changed. The symptoms have worsened. And keep in mind, you may get a variation of questions that ask you about the changing needs of a client. Don't be intimidated. They only want to know, do you know what to do first? Do you know what to do if the client's status changes? Question 3. The correct answer is B. You take into consideration the new information because we're living, breathing humans. Things change. They may come in better or worse, and throughout treatment, they may change. So you consider the new information and you work with the client to update their treatment. As treatment progresses, counselors continually collect new information about the client. The emergence of depressive symptoms changes the client's clinical presentation and may affect treatment priorities. The counselor should incorporate this new information into the case and determine whether treatment goals, interventions, or referrals should be modified. A is incorrect because this ignores new assessment information. C is incorrect because the client is reporting new symptoms, not successful completion of treatment. And D is incorrect because treatment planning should address both concerns whenever clinically appropriate. So you so this goes back to co-occurring disorders. I highly suggest, if I don't want to put extra schooling on you guys, but a substance use issue is a mental health issue. So most people are gonna be co-occurring in terms of, even if they don't have an official diagnosis, there's gonna be some type of mental health need, whether it's coping or grief. I suggest going to get licensed as a don't hurt me, y'all. Every time I tell my supervisees that, they're like, I'm not going back to school after I finish my substance use. But you don't have to, but have a solid knowledge of when a client may need to be referred out, or if you need to do if you're licensed both as a mental health professional and a substance use professional, you need to know when you're going into the co-occurring supports. But if you just want to do substance use, that's fine too. You need to have knowledge of when to refer the client out because you can't ignore the mental health symptoms. So if you get a question like this, they're asking you to recognize when the case is evolving and the client's needs are evolving. So you need knowledge and ongoing assessment, how to build a case and adjust and support the client with emerging needs. You need to understand treatment planning again. And then you need to understand co occurring disorders. Question 4. Which situation most clearly indicates that a treatment plan should be updated? A. The client has attended every scheduled appointment. B. The counselor prefers a different intervention. C. 30 days have passed regardless of clinical changes. Or D. The client has developed new symptoms and treatment priorities since the last review. Which situation most clearly indicates that a treatment plan should be updated? The correct answer is D. The client has developed new symptoms and treatment priorities since the last review. Treatment plans are revised when assessment findings indicate that the client's needs, symptoms, and goals and priorities have changed. And this can fall under regression or progression. So if the client is progressing, they're going to have different needs. If they're getting better, that indicates a different need, not just when they get worse. A is incorrect because attendance alone does not indicate a need to modify a treatment plan. B is incorrect because treatment planning should be driven by the client's needs, not the counselor's preference. And C is incorrect because although agencies often review plans on a schedule, revision should be based on clinical need, not simply the passage of time. So this is one of those situations where I tell you, a lot of us have a lot of experience. So a lot of times if you work in certain agencies or certain environments, you update or you do a meeting with the client automatically every 90 days, every X amount of days, which is fine if that's an agency policy. But if for some reason the client's need changes outside of that, it can be updated the third day or the fifth day or every week if needed. So for the exam, a treatment plan can be updated and adjusted in coordination with the client at any time, not just every 90 days. So don't forget, we're in a perfect world for the exam, not just your agency or your organization. Question 5. A client has maintained sobriety for 6 months but reports increasing anxiety about returning to work. The counselor should A. Continue using the original relapse prevention plan without changes. B. Add goals addressing anxiety management while continuing relapse prevention planning. C. Remove all treatment goals because sobriety has been achieved. Or D. Refer the client to another counselor immediately. What should the counselor do? Client has been in recovery for 6 months, but anxiety symptoms are increasing. Okay. CBs, okay. The correct answer is B. Add goals addressing anxiety management while continuing relapse prevention planning. And that can be either if you are certified and licensed to add an anxiety goal to work with the client on, do that, or you can support the client with referring out to a provider, a mental health provider. Either way, you support the client with those emerging symptoms. Recovery often brings new challenges. Treatment plans should evolve around addressing the client's emerging needs while continuing to support them. A is incorrect because the client's needs have changed. Treatment should evolve accordingly. So, again, this is a question that came up. If you're only certified in addiction counseling, you refer out. If your client is progressing and they want to address an eating disorder or a mental health condition, or they have housing needs, or things change that you cannot address, you refer out. C is incorrect because recovery extends beyond abstinence. And D is incorrect because nothing indicates that referral is currently a referral to another counselor is necessary. So you can continue to work with the client. You just support them with any needs that you can't help them with. If you get a question like this, it's asking you to recognize that treatment plans should grow with the client's progress. So you can see the theme of tonight. Things you need to know to study treatment plan modifications, phases of treatment. So where the client is in their substance use treatment, ongoing assessment, and recovery planning, which is going to always involve a relapse prevention plan, and supporting the clients with identifying who can support them in recovery. Question 6. When reviewing treatment progress, which factor should most influence treatment plan modifications? A, the counselor's preferred counseling theory. B, insurance reimbursement requirements. C, the client's progress, readiness for change, current needs, and ongoing assessment findings. Or D, whether the client agrees with every intervention. Which influences the treatment plan changes the most in our perfect world, in our exam world, not in real life world? The correct answer is C. Treatment planning is driven by clinical assessment and collaboration with the client. A is incorrect because treatment is individualized, not based on the counselor's preference. So even if you may have a certain way of being as a clinician, you might say, oh, CBT works well, or this type of therapy will work well. Ultimately, you're collaborating with the client and it's their preference, and you support them from their needs. B is incorrect because administrative requirements should not determine clinical decisions. Now, I know somebody gonna be like, but in our perfect exam world, everyone has insurance and all of the services are covered. Remember? That is not a barrier in our exam world. And D is incorrect because collaboration is important, but clinical decisions require both client input and professional judgment. So you're working together. So sometimes the client's level of care may require, their needs may require a level of care maybe they're, have some hesitation about. You can educate them on. Again, sometimes when clients are have medical complexities, they have to get educated on, certain needs that they may need more support in. But generally, you're doing it together. The care team, we're all working with the client. If you get a question like this, they're trying to see if you can identify the factors of a person-centered treatment plan. So you need to know about readiness for change. So where is the client at in this treatment process? Are they ready? Are they ambivalent? Do they have questions? Are they afraid? Do they want to go to rehab, but they don't know if they'll be able to keep their job? Where are they at in the readiness for change? You need to understand ongoing assessment. So the foundational knowledge would be you understand that there's screening, assessment, diagnosis, development of treatment plan. Those are the foundational knowledge. But you're always assessing for changes in the client's needs. And this is how you build your clinical reasoning skills. So those advanced tests will ask you the harder questions like that. They just won't ask you what a treatment plan is. They may give you a scenario where you need to be able to answer how to change the treatment plan. Question 7. A client from a cultural background different from the counselor expresses concerns that family expectations are influencing treatment decisions. What is the best response? A. Explore how cultural values influence treatment goals and collaborate on culturally responsive interventions. B. Encourage the client to ignore family expectations. C. Continue using the original treatment plan. Or D. Focus only on substance use symptoms. What is the best response? So the client's cultural background may be affecting treatment decisions and they have concerns. So this can be stigma that comes along with treatment. This can be level of care. So sometimes in certain cultures, they may be okay with outpatient counseling, but they may not be okay with rehab or a higher level of care because of stigma, or they may have distrust of certain medical. So it could be so many different things. Cultural background really plays a large role in how people respond to treatment and in how they, maintain recovery. So what is the best response? The correct answer is A. Explore how cultural values influence treatment goals. Cultural influences, including their values, their motivation, how they cope, how they seek help, and how they engage in treatment. We should be able to explore and not assume, and also not put our own personal beliefs, no matter how motivating it is. We shouldn't put our own personal beliefs on our clients. B is incorrect because dismissing or minimizing cultural values is not culturally competent and responsive care. So you may be able to speak up to your family, but that may not be an option for your client. Culturally, it may not be appropriate for them to tell their parents or family butt out. Not everyone engages within their cultural systems in that way. So that would be inappropriate to dismiss their concerns. C is incorrect because ignoring culturally relevant information limits your individualized plan. So remember, your interventions and your treatment should be person-centered, individualized, and if culture plays a big part in this client's care, you have to address it. And D is incorrect because effective treatment addresses the whole person, including cultural factors that influence recovery and treatment participation. So if you get questions about family and support and culture, you must address it, because the client may do well in treatment, but they have to go home to their support system. So it has to match their cultural background and their preferences. What is the exam asking you with these types of questions? They want to see if you're a culturally competent counselor, if you're able to take into consideration the client's cultural backgrounds, beliefs, integrate that into treatment so they can maintain recovery, so you can support them in the most person-centered way. These type of questions are trying to see if you understand that that's a pillar of our profession. What you need to know about culture, how to become a cultural competent counselor. You need to understand your client's values, how to make treatment person centered. The skills you're being tested on: cultural responsiveness and collaborating when developing a person centered treatment plan. Question 8: which documentation entry best reflects an appropriate treatment plan review? A. Treatment plan reviewed with client, progress discussed, and the current goals will remain in place until the next review. B. Treatment plan reviewed, client reports improved mood and continued participation in treatment with no additional concerns. C. Treatment plan reviewed collaboratively with the client, progress toward goal 1 was evaluated, the client identified new barriers to recovery, and treatment objectives were revised to address current needs. Or D. Treatment plan reviewed, client continues participating in services and agrees to follow the existing treatment recommendations. Which one is best? All of them could be a entry, but which one is the best, most comprehensive entry? Let me check the chat. All right, I see a lot of B's. Okay, we're rocking and rolling tonight, you guys. Good, solid, clear Wi-Fi. All right, lots of C's. Correct. C is the best entry. An appropriate treatment plan review and documentation emphasizes collaboration with the client. It talks about progress or regression, their goals, their current needs, barriers, and it explains any changes that need to be made or updated on the treatment plan. A is incorrect because treatment plan review with the client, progress discussed, and current goals will remain placed into the next review. This documents a review occurred, but it does not adequately evaluate the client's progress or provide sufficient clinical rationale. So don't ever forget the progress or the regression, because that tells you how the interventions are working. B is incorrect because it documents the client's status. It does not assess progress towards the treatment goals or demonstrate clinical decision making. And D is incorrect because this documents participation and agreement, but does not demonstrate an evaluation of the treatment goals, progress, or clinical reasoning behind treatment decisions. So C would be the best entry. Question 9. A client initially in the preparation stage has relapsed and now expresses uncertainty about changing substance use. The counselor should: A. Keep the same interventions because relapse is expected. B. Reassess readiness for change and modify interventions based on the client's current stage. C. Discharge the client for non-compliance. Or D. Increase treatment intensity without discussing it with the client. So the client initially was in preparation stage, preparing for change, preparing to do all the things. They relapsed, which is a part of the process. And now they're uncertain. They may not have as much confidence in working towards recovery. So maybe you see them not trying as much. They're having a change of heart about working towards recovery. What is the best? What should you do? What is the best answer? Most appropriate answer? The best answer is B. You reassess, identify the readiness for change, and work with them to modify interventions, goals on what to do next based on where they're at now. So in the beginning, they may have been ready, but now they're in a different stage. So now you have to modify. Relapse often changes a client's readiness for change. As addiction professionals, we should assess motivation and modify interventions accordingly. A is incorrect because intervention should match the client's current stage, not the previous one. C is incorrect because relapse is not automatic grounds for discharge. D is incorrect because treatment changes should be collaborative whenever possible. And again, I always say this, we are a specialty under mental health and substance use. So that is why we need to be certified and trained and be lifetime learners, because it can be more challenging. We're working with a population that is going to be hard. So we expect some challenges and difficulties. That's what we're here for, to support them in that. So anytime you see something about a discharge and it doesn't say anything about the client reaching their goals, or the client explicitly communicating that they do not want services anymore, discharge is not going to be the answer. We're going to reassess and we're going to support them and meet them where they're at. That's going to always be the answer. So when you get a question like this, the exam is trying to see if you recognize stages of change and see if you can adjust treatment according to the client's readiness. And this all goes back to health and safety, keeping the client safe. So we shouldn't have expectations of a client if their circumstances have changed. So that's what this type of question is asking you. And for this, you need to know they are testing, again, stages of change and treatment planning skills. Question 10. Which statement best reflects effective treatment planning? A. Treatment plans should follow a standard format so all clients receive the same interventions. B. Treatment plans should evolve as new assessment findings, client preferences, and clinical needs emerge. C. Treatment plans should remain consistent unless the client experiences a major relapse or crisis. Or D, treatment plans should focus primarily on the counselor's clinical recommendations and professional judgment. Which one is effective treatment planning? The correct answer is B. Effective treatment planning is ongoing and collaborative. Treatment plans should be individualized and updated as new assessment information, client preferences, and needs change over time. A is incorrect because although your organization or your agencies may use a standardized template, treatment plans may be individualized to address each client's unique strengths, needs, goals, and circumstances. So it shouldn't be the exact same wording for the exact same diagnosis. It should not be cookie cutter. Something should distinguish one treatment plan from the next. C is incorrect because treatment plans should be reviewed and adjusted whenever clinically indicated, not only after setbacks or crisis. And D is incorrect because clinical judgment is important, but effective treatment planning is collaborative and incorporates the client's needs, preferences, culture, them as an individual. So for a question like this, the exam is trying to see if you can identify the principle that best reflects effective person-centered treatment. What you need to know, you need to understand treatment planning and individualized treatment planning. You need to understand the skill of assessing the client, but also ongoing assessment throughout treatment. You need to understand person-centered care and also why our interventions are collaborative, why this type of treatment is always going to be collaborative. And then you also need to understand clinical decision making. All right, so key takeaways for tonight. So, understanding that treatment planning is ongoing. Also, that all treatment planning is always going to be client centered. You need to be collaborating with the client. You need to use your counseling skills and assessment skills to assess throughout treatment. You support the client with measurable goals, so relevant, time limited. Y'all know what SMART goals are. And you get all of that information from assessing the client and using rapport building skills to get the most accurate information. A treatment plan can be updated as needed. So if you get a question about that, as needed, as the client's needs change or need to be adjusted. Always document the why. Also, progress. So don't forget if the client is progressing or regressing, but also the intervention and why. Why is it being adjusted? Consider culture and background in the client preferences. Build on the client's strengths. So this is where collaboration comes in. So you get to understand what they're confident about, what they're not so confident about, what stage of change they're in. And you modify the goals based on that. And individualize every plan. All right. Let me turn on my camera for you guys. All right, we have a few minutes. Let me go to the chat for you guys. So basically just reinforcing ongoing assessment, ongoing assessment. So whether you get a question like, let's think of the most easiest question. What is a treatment plan, or when can you change a treatment plan? Anytime. Or if you get like a more difficult question, they may give you a scenario, and it may be a long scenario, and they may throw in some words. Don't let it trick you. Just read it slow and be clear on what they're asking you. Because sometimes certification and license exam, they set the scene for you, but they're asking you something very simple that you know the answer to. Joy Edison, do you do one-on-one sessions? Yes, I do. I have a few slots. If you go to the Stand Store link under the description of all of my videos, you can get a 1-to-1 hour session. And before you book a 1-to-1 session, download the free study guide, and then maybe consider the more detailed study guide. That's $15.99. If you feel like you got a grasp of it, you may not need a one-on-one, because the one-on-one, we're taking an entire hour, and you get 2 topics, and we come up with a strategy. And I would suggest, if you book the 1-to-1, do the 2 topics that you feel like you're the weakest in. Thank you guys. Thank you guys for joining me this evening. Don't forget to like the video, you guys, and make sure you're subscribed to the channel. So when you log onto your YouTube, when I do community posts, you'll be able to see it. Also, don't forget, in August, I'm doing intensives. So in August, on Wednesdays, every Wednesday in August, I'm starting at 6, but I'm not ending to 9. just so we can have some intensive sessions on the page, and we'll split it up on 3 different topics. So it'll just be just like tonight, but 3 hours in a row. I think intensives are important. So if you can join me for the whole 3 hours, it can give you an idea of, how to focus for long periods of time to kind of prepare you for testing. But also, it gives you another option because everybody can't join us weekly. So some people might just want to do 3 hours once or twice a week instead of 1 hour. So whatever your study strategy is, I want to have something for everybody. So starting the first week of August, I'll do a 6 o'clock topic, a 7 o'clock topic, and then an 8 o'clock topic. There'll be 3 different topics. If you can't do the whole 3 hours, just jump on from 6 to 7, or jump on from 7 to 8, or 8 to 9. And as always, if you can't make it, just make sure you show the playback some love. Watch the playback. Either way, we'll get it done. Okay, so Extra Good says, so just to clarify, in the test world, when dual diagnosis questions come, we have to answer as a licensed mental. No. You answer. Now, the test is not going to try to trick you. I don't believe that the test will try to trick us. I say with co-occurring disorders, make sure you address both issues. So they may give you an option that says refer out for whatever the other issue is. So for example, you get a question about, you're working with a client who has both a substance use issue and an eating disorder issue. They may ask you, what do you address? Do you only address the substance use? No. You will refer out. So you don't answer as a licensed mental health professional, but you just make sure you address both issues. I'm sorry. I hope I didn't confuse you guys. Angel sent first. It's always Eastern time. Sorry, you guys. So in August, it's Eastern time because I'm in Virginia. So it's 6 p.m. to 9 p.m. in August. So you'll have 4 intensive sessions in August. Okay, I'm going back looking at the chat, guys. Just making sure I'm answering everyone. Again, thank you guys for joining. Thank you for supporting the channel. Oh, Miko, I passed the IC and RC ADC test. Thank you. Congratulations. Let me see if I can pin your comment. Congratulations, Miko. I guess ADC is still going to be in the lead, you guys. Our learning partners, the test that has been most passed is the ADC. And then I think second would be between the NCAC1 and the AADC. I have to go back and look. Congratulations, Miko. Your hard work paid off. Best wishes on all your career journey. Okay, I see everybody. Oh, I'm going to pin the message. Okay. I'm getting better, y'all. I think I'm a streamer now. Miko passed the ADC. Okay. Check you out. Thank you. Happy to help Miko. Thank you, Letitia. I appreciate it. So Extra Good 1. So if you get a question about the client having 2 issues, You address, they're going to ask you in so many ways. They want to see if you know that you have to address both. Now, you're not addressing them both personally. Let's say you're just taking an addiction counselor exam. You need to choose the answer that addresses both, whether that's like you work with the substance use and then you refer out for the other issue. So basically, for co-occurring questions, you have to address both. That's the most important thing to remember. If you have a client with a co-occurring disorder, whether it's two substance use disorders, a substance use disorder and a mental health disorder, or a substance use disorder and another addiction, they have to be addressed together. Evidence-based says they need to be addressed together. Now, depending on your question, you need to choose the question that best reflects that answer. I hope I'm not confusing y'all. So, co-occurring, both have to be addressed at the same time, but you may not be able to address both. You may have to refer out for the other issue. Have a good evening, everyone. No worries, Joanne. Keep at it. Keep joining us. Joanne, do you have an idea of what topics you want to keep working on? Yes, Angel. Everyone can pass. If you're still here, Joanne, or if you see this on the playback, you can answer in the comments. No worries. Now you have an advantage. I believe if you fail the test, just take it again. That was just a test run. Okay, great. Extra good one. Yep, co-occurring. They must be addressed together. No worries, Joanne. Okay, everyone. Again, thank you so much. Give the video a thumbs up. Make sure you're subscribed. Share with someone that is studying for an exam. And I will see y'all next week. Next week is is next week the first intensive? Let me pull up my calendar, you guys. Yes, it is. I want to see who's going to hang out all 3 hours. So yes, the first intensive is next week on the 5th. So I'm starting at 6 o'clock, 6 p.m. Eastern. One topic first hour, another topic second hour, another topic third hour. We're going 6p to 9p. All right. I hope everyone can join me. Have a good night, everyone. See you next week.